What role do beta blockers play in varices management? Imagine a tiny highway of blood vessels in your liver that can get blocked or congested, leading to dangerous pressure buildup. That's what happens in cirrhosis, where scar tissue makes blood flow through the liver harder. This increased pressure in the portal vein can cause esophageal varices, which are swollen veins in the esophagus that can burst and cause serious bleeding. Managing these varices is crucial to prevent life-threatening complications. Beta blockers, especially non-selective ones like propranolol, nadolol, and carvedilol, are key players in this management. They work by lowering the pressure in the portal vein system, which reduces the risk of variceal bleeding. They do this in two main ways. First, by blocking beta-1 receptors in the heart, they decrease the heart's output, which lowers blood pressure overall. Second, by blocking beta-2 receptors, they cause blood vessels in the splanchnic circulation, the vessels supplying the intestines and spleen, to constrict. This vasoconstriction decreases blood flow into the portal system, helping to lower the pressure that causes varices to form or bleed. Even a small reduction in the hepatic venous pressure gradient, which is the difference in pressure between the liver's blood vessels, can make a big difference. When this pressure exceeds 12 millimeters of mercury, the risk of bleeding increases significantly. Beta blockers can lower this pressure by about 15%, which can cut the risk of the first bleeding episode by nearly half. They are also effective in preventing rebleeding after an initial hemorrhage, making them a cornerstone in long-term management. Research shows that using beta blockers can reduce the chance of dying from variceal bleeding by about 25 to 45%. Carvedilol, a newer non-selective beta blocker, has a stronger effect on lowering portal pressure than propranolol and is considered safe even in patients with more advanced liver disease. Dosing is tailored to each patient, starting low and gradually increasing based on blood pressure and tolerance. Regular monitoring is essential to avoid side effects like low blood pressure or kidney issues, especially in those with decompensated cirrhosis. In clinical practice, if patients cannot tolerate beta blockers because of side effects like fatigue or dizziness, doctors may recommend endoscopic procedures such as variceal ligation, where the swollen veins are tied off with small rubber bands. Sometimes, combining beta blockers with endoscopic treatment offers the best protection for high-risk patients. In summary, beta blockers play a vital role in controlling portal hypertension, which is the root cause of esophageal varices. By lowering the pressure in the blood vessels supplying the esophagus, they help prevent both initial bleeding and rebleeding episodes. Their use has been shown to improve survival and reduce complications in people with cirrhosis. However, because each person's condition is unique, healthcare providers carefully personalize treatment plans and monitor for side effects to ensure safety and effectiveness. Always consult with a healthcare professional for tailored advice and management options.